I think we're going to go ahead and get started. People will come in. I'm Mitzi Schindler. I'm with the Aurora Chamber of Commerce, and thank you so much for being here this morning. This morning, we are here to hear Addison McGill talk about recovering from the mental health effects of COVID. And I'm going to turn this over to Patty to introduce Addison and to get us started. Thanks.
Good morning, everyone. Thanks for joining us. We're really excited about Addison and this topic today. A little background on Addison. Addison McGill has a master's in social work and a master's in health administration and is a licensed social worker. He is the director of business development at HCA Healthcare and is responsible for business development and issue resolution with the Medical Center of Aurora's behavioral health service line. He believes in client advocacy as a means to achieve social justice for oppressed and marginalized populations. And we are very happy to have him today.
Patty, thank you. I had written down that I needed to do my own introduction, but that was perfect. I appreciate it. Good morning, everyone. As Patty noted, I'm Addison McGill, licensed social worker. This is the type of stuff I'm really passionate about. This upstream work where we're talking about education, health promotion, prevention. Just want to thank you again for joining us this morning. It's an important topic and one that I think we'll continue to hear about as we move forward. In my introduction, one thing that wasn't noted, throughout COVID-19, we were all forced to adapt in various ways. And as you can imagine, the business development side of what we could do here as an organization kind of faltered and slowed down tremendously. And so about April of last year, I was repurposed to our outpatient programs. So a lot of what I'm going to be talking about today is based on experience in working with patients here at Health One's Behavioral Health and Wellness Center. I worked in a group therapy format for both adolescents and adults. And so really a lot of what I'm going to be talking about is founded in research and my experience. And I come from a place where, I think we're all students and we're all teachers. And so I'd love for you to just feel comfortable as you can. Hop in if you have any questions, if you have any points to make. This is a safe place, and I would encourage you to share your thoughts as well. These are the learning objectives that I'd set forth for us this morning. We're going to talk about, obviously, the mental health impact that COVID and really 2020 as a whole brought to the table. We're going to talk about whole person wellness. I don't think we can just talk about mental health. We're all whole people. So when we talk about physical health, I think it's important to talk about mental health and vice versa. We're going to talk about health outcomes. How does that look for different groups? What can we expect moving forward? And then, of course, what can employers do throughout all of this? I think there were a lot of silver linings that we'll get through here in this presentation. I think before we talk about where are we going, it's important to talk about where have we been and how have we done over the course of the past year. And so Mitzi put together a poll for us, and we're looking for some engagement here. Mitzi, if you're able to load that poll, we'd love to get that going. It's got just 3 or 4 questions here.
Can everybody see that?
All right, I see some numbers moving here. %80 response rate, that's pretty good where I come from.
I can't seem to vote. Can a co-host not vote? Is that the thing?
I was trying to click on some options as well, Patty, and I couldn't do it either.
Okay.
So you could be right.
Well, there's your
We're up to 90%. A lot of these questions are based on what we're going to talk about today. So I thought it'd be good to kind of gauge where we're at and where we were last year as well. Looks like the large majority of people did not put off any medical procedures. Kudos to you all for not doing that. I will say I was guilty as charged there. looks like a lot of folks believe that telehealth or telework, excuse me, is going to be continued as an option moving forward. I agree with you, and we'll talk about some of the concerns that we might have if that in fact is the case. Wow, a wide range of emotions here. Is everyone able to see the results of the poll? No. So just looking at the, let me take a step back. 73% of people said that they did not put off medical procedures. 73% of people said that their organization will probably continue to offer a telework option. 27% said they don't know. So I'll try to hit on why it's important to communicate those things to staff later in the presentation. And then as far as emotions, top emotions were hopeful, anxious, frustration, worry, and then sadness and fear. 27% said happy was a common emotion over the course of the pandemic. All right, so thanks for completing that. Missy, again, thanks for putting that together for us. We know the last year is just, brought challenges like never before. I work for a large hospital system, and we were faced with so many difficult decisions and choices and problems that really we'd never been faced with previously. As a result of constant change, over communication, under communication, changes in anticipation of what we thought was going to happen. I've heard people say, it was 2 weeks to bend the curve, and here we are a year later. I think we all came together and rallied for the most part, and we were there for our communities. Some people did really well throughout the pandemic, some maybe not as much, as we could see by the poll that we just did. When we're talking about change, there are always anticipated emotional changes and things that we can expect. And always it's important to just try to remain grounded and do what you can to stay in the moment. Past year for a lot of people I've talked to felt like a blur, and it happened so slowly, but it happened so fast as well. It seems like time has really changed, and our perceptions of time have changed as well. So we talked about how we were last year. How are you doing today, folks? I always think it's important to take time for a self check-in. How are you feeling today? The past really shapes who we are. So everything that we experienced last year does have a lasting impact on us, especially as it relates to our emotions and our resiliency. One emotion that's not listed here that I came across in talking with a colleague is a term called languishing. Is anyone familiar with languishing? Yeah. So the way it was described to me is languishing is a sense of stagnation and emptiness. And in talking with other colleagues, it seems like that might be a common theme for a lot of people right now. It's kind of this foggy feeling that we may have going through the motions of the day. Maybe we're not as motivated as we once were. I think, the pandemic has a lot to do with that. We'll talk a little bit about burnout today, but I think languishing is something that not listed here, but something to keep in mind. It's important to note that no matter what emotion we're feeling, those emotions can impact us. We know that our emotions impact our thoughts. Those emotions and thoughts then impact our behaviors. So it's important to do self-check-ins regularly. We use a common concept called name it to tame it when we're working with patients, and that's simply just naming your emotion, saying how you're feeling, whether it's out loud or to yourself. We know that that engages a higher functioning level in the brain and helps us to relax. Again, a point to be had here is that some people are thriving, and that's okay. And some people are still, working through things and maybe not doing as well, and that's okay too. So in June of last year, the CDC completed a survey of about 10,000 people. And as a mental health practitioner, after we started seeing these early survey results, there were some concerns. We, at that point, realized, hey, our communities are suffering. We, as a behavioral health facility, started to notice an increase in demand. Specifically, anxiety and depression were up significantly year over year. Anxiety was up 25% versus 8% in 2019. Depressive disorder was up 25% compared to 6.5% in 2019. A troubling and very serious concern that we had is the suicide statistic here. 11% is pretty high, and we know that there were some discrepancies in the people who were saying that they were seriously considering suicide. Specifically, people ages 18 to 24, so young adults said they were, about a quarter of them said that they were seriously considered suicide in the past 30 days. 18% of Hispanic respondents said they had also considered suicide. Unpaid caregivers was 30%, which was the highest population who'd said that they had seriously considered suicide in this time period. As you can imagine, a lot of the people who said that they had considered suicide also had some negative mental health issues going on at the same time. So we know there oftentimes is that combination of mental health issues, suicidality. Just because someone has considered suicide doesn't necessarily mean that they have a mental health condition, although if they do have a previous diagnosed mental health condition, sometimes that can be a contributing factor. One thing that's maybe not talked about as much outside of my circle is substance use. We know that substance use rates have been on the rise, and throughout COVID, a lot of people have been coping in various ways. And unfortunately, some folks have turned to substances as their main coping tool. And it's something that I would say we need to be very careful in watching moving forward. With mental health conditions such as anxiety and depression, the symptoms that you'll notice for those two diagnoses, you're quicker to see oftentimes than with a substance use disorder, especially if that substance use disorder is alcohol. In Colorado, maybe marijuana. Those are what we consider socially acceptable drugs here. And in my experience working with patients who have substance use disorders, oftentimes it takes a while before they get to a point where they're actually seeking treatment. And so it's my personal belief that as we get forward, hopefully bending the curve on COVID, we're going to see more people who have realized, well, I've been coping with an unhealthy coping skill, which is substance use, and maybe I need some extra help and support. Another survey that was done last year was the Household Pulse Survey. This actually was just wrapped up about a month ago at this point. Anyone out there, have you been looking into the Household Pulse Survey? Are you familiar with it? If you're a data dork like me, I'd encourage you to check it out. There's a lot of great information in there, and so from a high level, I just wanted to cover a few things here. Looking at the statistics, there was a peak of these mental health conditions in this survey in November and December, with a significant amount of people showing symptoms of anxiety and depression. The survey used a PHQ-4, which is a combination of an anxiety and a depression inventory scale to gauge how people were doing emotionally. As you can imagine, there may be some reasons why people would be more anxious or depressed in November, December. Anyone want to throw out any ideas as to why that would be?
The holidays, being alone for the holidays.
Yeah, I would agree with you. I think the holidays last year just felt anything but normal. I know specifically talking to my family, I was told, don't come visit me. We don't want anyone to come visit. And that was hard. And I don't think I was alone there. I think a lot of families were forced to make difficult decisions as to whether or not they'd see their loved ones over the holidays. We know that isolation in particular contributes to depression. It can contribute to anxiety. And I was talking to my patients along the way during COVID and saying, at this point, when we're saying you need to stay at home, you don't need to go out, don't be around people, really what we're prescribing is a depressive symptom at that point. We're telling you not to do all the things that I usually tell someone to do when they are depressed, which is get out more, be around your support systems. So to me, while unfortunate to see these numbers, I think they were really to be expected for the most part. Interesting bullet point there at the bottom. The most recent survey concluded in the end of March, so not too long ago. But 13% of adults expect someone in their household to have a loss of employment income in the next 4 weeks. And so that's right now. There are still people who are concerned about their financial status, and we know that those things will contribute to our mental health and how we're doing, physically and mentally. The Household Pulse Survey, like I said, it's got a lot of great data points outside of just mental health. There are a lot of social determinants of health statistics that are incorporated in there. Colorado did pretty well overall. You can actually filter this information by state and national numbers. 6.7% of adults at the end of March said that there were food scarcity issues. That was lower than the nationwide number. There were 32% of people in households in Colorado that said that they were not up to date on their current rent or mortgage, and that eviction or foreclosure was something that they were facing in the next 2 months. So that was 32% here. I think the cost of living is something that we need to consider for a lot of folks, especially in the Denver metro area. We know that there are parallels, and we'll get into this, but there are parallels between how am I doing, with food, with housing, with education, and my mental health and physical health. One thing that we most definitely saw was healthcare utilization, which is why I asked, did anyone put off any healthcare visits? I was guilty. I read at one point that some organization somewhere said, hey, wouldn't recommend going to get a dental visit right now. We're not really sure how the virus is spreading, and it might be a concern. That was a sign for me to skip the dentist, which is usually a painful trip for me. So I took full advantage of that, admittedly. There was this contagion fear, really, that we saw in communities from a hospital standpoint. We know that as COVID numbers rose, so did the number of people seeking out care in the emergency department. And it's interesting to look at the data points as to which age ranges saw the highest decrease. So we're looking at 65 to 74-year-olds as one of the highest populations that stopped going into the emergency department. It's interesting when you look at that admissions number. So what we're saying is more people in this age range didn't go into the ED, but if they came to the hospital, they were more likely to get admitted. There are obviously concerns with that, but it makes sense. If we were saying that this was an at-risk population for COVID, it would make sense that we're thinking, hey, a hospital, sick people are there, COVID cases are obviously there. Maybe I shouldn't go into that setting to take care of myself. Interesting statistic that ED visits for females decreased a little bit more than males. And then there's some also parallels for non-Hispanic Asian Americans and non-Hispanic Blacks. And so as we're moving forward in this presentation, I think it's important to note that if we're promoting health, we want to ensure that we're promoting it equally and equitably for people. And so you'll notice that I am trying to tie in various statistics for certain populations. And so what does this mean moving forward if we're saying that certain people are putting off ED visits or putting off healthcare utilization? To me, I think it could potentially end in increased mortality for these populations. We had our team here run statistics on the number of people by service line who had a mental health condition. And looking at the numbers, it was interesting, all of our service lines were down: oncology, cardiology, even OB, obstetrics, which is interesting because we can imagine that people are still getting cancer, people are still dealing with cardiovascular disease. Unfortunately, they're just not getting treatment for it. So long-term, something we'll definitely need to be on the lookout for. This was an interesting graph I found doing some research for the presentation. These numbers actually came from my organization that I work for. So you can just see a visual representation of what ED visits looked like for us. We treated about 6.4% of ED visits in the country last year. And so as we looked at this number, these staggering numbers from a provider standpoint, we thought it'd be important to try to be more engaging with patients. We started to do more outreach directly to consumers and just letting them know that hospitals were a safe place to be, that we were taking all the necessary precautions. And then we were having community meetings as well. So we still had meetings with primary care groups trying to address their concerns about PPE and what measures are in place to ensure that people can get into a hospital, and how do we streamline that for patients who are concerned about coming in. Really, there were no easy answers there. I think as a whole, our organization did a great job managing things that we had never been faced with before. So healthcare inequality is something, as I kind of alluded to. We know that even prior to COVID, that there were serious healthcare inequality issues across our country. And I've got some bullet points listed here. Top of mind for me oftentimes is certain chronic conditions that we know that some populations are more likely to face. For African Americans, oftentimes that's going to be diabetes and cancer. For Hispanic populations, we're talking about obesity, diabetes, cardiovascular disease there. These disparities were also key risk factors for folks who may be getting more sick from COVID. So those underlying health conditions actually were contributing to more acute stays for folks, especially based on their racial status or their socioeconomic status for that matter. We know that these are very complex issues. I think we could probably do a full hour presentation on just these bullet points in this slide alone, but we don't need to do that today. We know there's enough barriers. Access barriers are one of them. You know, in Colorado, we see a very diverse patient population. I think the last I heard is in the Denver metro area, there was over 120 languages spoken. So we know that that oftentimes that is a contributing factor for people who can't get care or don't know how to access care. If you can't speak the language or understand the complexity of the systems, that can be a barrier to getting care in the first place. COVID rates for these at-risk populations definitely is something that was brought to the forefront during the pandemic and will continue to be talked about moving forward is my hope. It's important to note that we're all talking about doing things to improve some of these outcomes. So when I say we, I mean all of us, communities, providers, advocates. And so we can't simply rely on what we have as a current healthcare system without considering the unique barriers to each population. And so it's important for us to understand what those are and make informed decisions moving forward. As I discussed, we saw these statistics for COVID cases significantly increase among certain populations. 27% of COVID cases were contributed to by people of color, Black people. Black Americans were dying at a greater rate. The mortality for Latinx people was 2.5 times higher than white people. The Navajo Nation had the highest infection rate per capita in the United States, which was an interesting statistic for me. At the same time, I think it's important to consider the context of the world that we were living in throughout most of the pandemic. I would say that racism and discrimination were two things that were really brought to the forefront and continue to be for that matter. Curious to know, as far as healthcare inequality, I covered those two slides pretty quickly. As I said, there's a lot that we could dive into there. I'd be curious to hear from the group if there's anything you'd like to add to this conversation. Is there anything that I'm missing here that we haven't discussed that you think would be important to touch on as it relates to healthcare inequality?
I guess I would just say, and it's not per se healthcare inequality. I mean, as a result of that to a certain extent, but I was just listening to a study this morning about Black Americans and their mental health, and they've actually done some correlated depression, lower feelings of well-being in states where a killing of an unarmed Black man by police occur, and the depression scores have actually gone down. It's a little bit of a rudimentary test. I can't remember the name of it, but and it was just just that feeling of powerlessness, and we're hearing more and more about the effect of racism on mental health of Blacks and people of color in America. So that was pretty sobering.
Yeah, thanks, Michelle. I think you're spot on there. I do have some statistics further on in the presentation as to how racism, discrimination actually impacts mental health. To your point, it's something that we can assume it's going to happen if we're concerned about our livelihood or being targeted simply because of the way we look. We can only imagine how that would impact us emotionally. So thank you for that. Anyone else want to chime in? No worries. So 2020, was it a year to remember or a year to forget? I don't think we'll be forgetting it anytime soon. As we talked about in the earlier slides, we know that mental health has been impacted in various ways. Physical health has most definitely been impacted by COVID-19. We know that there are disparities for each, and we'll continue to dive a little bit deeper into that. It needs to be said that we really have engaged the full impact of a lot of what I'm talking about today. From a behavioral health provider standpoint, I think a lot of the issues that we're talking about are going to have lasting impacts for generations to come, not just years. And without further research, a lot of what we're doing is speculating and kind of projecting, but based on the evidence and what we know about pandemics or crises, we know that oftentimes there are lasting or residual impacts that we'll continue to study in the future. Personally, I think there was both good and bad to be had with last year. Oftentimes it's a matter of perception and what are we looking for? I think that the equity conversations, the racism and discrimination conversations were brought to the forefront, and it's my hope that this is really just the beginning of those conversations. To me, now is the time to be enacting policy and getting things done so that moving forward, we as a society can feel like, all right, we have learned from some of these things and are making actionable changes to address the root causes of what we're concerned about. I had a teacher in grad school who was famous for saying, you know, it's important to chew up the fruit and spit out the seeds. And so that's what I think we should all be doing at this point, is trying to take out the fruits of what we learned over the past year, spit out the seeds, and then make some actionable steps moving forward. It was important to find balance throughout the course of last year. I've done presentations with employers and promoted self-care and resilience. And finding balance was something that we were always talking about, and that's always different for everybody. But let's dig a little deeper into some of these issues. I think one thing that I don't hear too much about still in my small circle of providers in behavioral health world is trauma. Trauma is something that personally I think that we can all relate to throughout the course of the pandemic. There's a definition here. We define trauma, or SAMHSA does, as an event, a series of events, or a set of circumstances that an individual experiences physically or emotionally harmful or life-threatening, and that has lasting effects on the individual's functioning. And so again, as we started the presentation with today, what we've experienced kind of leads to who we are today. And those emotional impacts, those things that we were forced to overcome, those are going to stay with us. It's important to know there are various types of trauma. So just because we weren't directly impacted by an event doesn't necessarily mean it can't be considered traumatic to us. We could talk about direct trauma where it happened to us personally, or indirect trauma, which I think is probably one that should be highlighted in the context of today's conversation. Indirect trauma is something that occurs when we're exposed to a series of difficult images or stories, and that can be secondhand with conversations and working with patients or clients. That could be also through the news, through social media. And so when we are looking at prevalence rates of PTSD, we know that after disasters, typically there's a 30 to 40% statistic for direct victims to suffer from PTSD. 10 to 20% of rescue workers will suffer from that event. And interestingly, 5 to 10% of the general population will be similarly affected. So what that means is you don't necessarily have to be tied directly to an event to be at risk for PTSD-like symptoms. Any questions about that? So when we're talking about trauma or traumatic events, everyone's going to react a little bit differently, but there are common symptoms that, as a clinician, that we're on the lookout for. When I was typing this slide up, I was thinking, these are all the things that we've talking about throughout COVID and working with employers and patients and staff. And so these common symptomologies of trauma, we're going to continue to talk about moving forward. In 2013, the American Psychiatric Association revised their criteria for PTSD to include repeated or extreme direct exposure to adverse details of a traumatic event. And so what that means for folks like myself is that I can be at risk for PTSD simply by talking to patients consistently about their traumas. We know that there's an energy exchange when we're having those conversations, and so it's important for clinicians to be on the lookout for that exchange and be present in the moment on how that's impacting us emotionally. We know that trauma can lead to issues in the workplace as well. From a healthcare provider standpoint, there was a lot going on in the midst of COVID. There were a lot of changes in communication and standards and PPE requests, and then also the recommendations for said PPE. So all of those things contribute to minimal detrimental outcomes to a certain extent. And so we know that trauma is, PTSD in particular, there are oftentimes little traumas that build up to a bigger event. And so we'll dive a little bit deeper into how those little events can contribute to PTSD in the future. We know that there are risk factors that we need to be on the lookout for. The severity of the exposure, was it direct, was it indirect? This post-event stress bullet point, I think, is super important in the context of COVID, because all of these things most of us were concerned about. Loss of employment was very real for most all people in this country, I would say. Relationship issues have faltered. We know that in China, at least, the divorce rates went up significantly after COVID. And then resource deficiencies. So when we're talking about our ability to tap into resources, whether it's food, whether it's housing, whether it's transportation, all of that has an impact on our mental well-being. There are the individual factors that we touched on as it relates to healthcare, and so it's very similar in PTSD risk factors as well. There are social and community factors, which we're going to get into in the next couple of slides. Protective factors, so these are things that help us to do well throughout traumatic events or to help us to maintain resiliency. We all are a little bit different in what we bring to the table here. And there are a number of skills that we want to be looking into as it relates to protective factors. Oftentimes, it's a matter of perception. So our ability to reframe things has a tremendous impact on our emotional well-being. We know that people who are resilient oftentimes will see that control is something that we don't always have. And so it's okay not to have control of a situation. Throughout COVID, there were so many things we didn't have control over. We did not have control over whether or not we could go see our favorite movie. The movie theaters were closed. Our restaurants were closed. We were told not to go see family. We were told to wear masks out in public. And so we were forced to adapt in so many ways there. But I think throughout all of that, a lot of us were able to, maintain meaning of the situation. And what I mean by that is, I'll use my personal experience, me going into a store with a mask on. Well, I'm doing my part so that if I have this COVID-19, I'm not passing it on to my community members. So there were some personal values that we could associate with the things that we were doing throughout the pandemic. And that's one thing I hope that we've all gained a little bit better understanding of is, what are our values? What are those things that are meaningful for me? Continuing with trauma, just because I think this is so important. We know that some people are more likely to be exposed to traumatic events, and I mean, healthcare workers, frontline workers, children could be considered in this as well. That's one thing we haven't really hit on too much. There are a lot of children in the world who were in difficult environments prior to COVID, and COVID would probably increased some of the stress in people's lives, especially in families. And so we know that there's trauma going on in homes that's not being addressed at this point. Another population that comes to mind are seniors who are locked in residential facilities, unable to see anyone. We know that isolation was very real for them. Concerns about their health and ability to fight this nasty disease, COVID-19, was very real for them as well. For people who've had COVID-19 and been hospitalized, we know that mental health rates for them are significantly higher than the general population. As you can imagine, fighting a disease that could potentially take your life would cause some sort of trauma and lasting impact on our emotional well-being. We always preach trauma-informed care here, so I think it's important to note that trauma is very real for a lot of people. There are studies that have been done. One such study is the Adverse Childhood Experience Study. Everyone familiar with that? See some head nods, some shakes. So we'll go over this briefly. The ACE study was done by Kaiser Permanente in the early 90s, and what they looked at was traumatic events or adverse childhood experiences. And they broke down those experiences into 3 categories. That would include abuse, neglect, household challenges. So taking a step back, a lot of that we've been talking about throughout the course of this presentation. And so we know that those challenges or those adverse experiences actually contribute to our mental and physical health. The researchers in this study found that 50% of the people had at least 1 ACE, and about 1/4 of people had greater than 2 ACEs. Individuals with 4 or more adverse experiences were 3 times more likely to have lung disease. They were 4.5 times more likely to develop depression in their lifetime. They were more likely to engage in substance use and risky behaviors as well. So the reason I bring that up, again, the things that happen to us stay with us and can impact us both mentally and physically. So discrimination is the unjust or prejudicial treatment of people based on their race, age, sex, or other factors. As it relates to racism, discrimination happens when we're acting on racist thoughts, whether that's consciously or unconsciously. This is an interesting study that looked at adolescents and how the discrimination that they were faced actually impacted their sleep. And the population, it was 41% Asian, 22% Black, and 37% Latinx. What the researchers did is they measured sleep based on duration and quality. And then they had the adolescents wear a wrist watch that would collect data on their sleep quality and duration. What they found was there was a negative impact that discrimination had on sleep, and their psychological health was compromised as a result of these factors, of both the discrimination and the sleep issues. The data suggested that discrimination had a negative impact in adolescents, especially those who weren't or who were still in the process of exploring their own racial identity. For kids who were comfortable in their racial identity, it was actually a less negative impact on sleep. There was a silver lining in this study. The researchers found that the individuals who were actually getting more sleep were more likely to be resilient throughout the course of feeling some discrimination. So the better sleep they were getting, in turn, the better their emotional and mental health. So it's important to note that research has shown consistently, at least over the past decade or two, that adolescents oftentimes aren't getting enough sleep. There's been policy measures, and schools have started later as a result of saying kids don't get enough sleep, and they're not functioning as a result. We talked before that at-risk youth throughout COVID were 18 to 24 predominantly, and that oftentimes is a significant change in the lifespan for folks, because people of that age are often moving out of the house, they're going to college, and we know that as that's happening, we're also getting less sleep as well. So in the context of everything we're talking about, discrimination we know has been very real throughout COVID. Sleep has been difficult for most all of us, and all of that culminates to have an impact on our mental and emotional well-being. So looking at racism, which is a belief that our personality and behavioral and morals are traced back to race, and the belief that one race is superior to another, we know that racism, trauma, emotional well-being are all tied together as well. There are some statistics up here that I don't think would shock anyone, and I try to break that down to look at various populations. Asian Americans were facing discrimination throughout the pandemic. It's been getting a lot of attention recently as a result to unfortunate events that have happened in the country. But 150% rise of hate incidents in over a year is pretty significant. Psychological distress is common for people of color and minority populations, and those symptoms can present differently based on the population. Specifically for Latinos, we're talking about nervousness, hypervigilance, lower quality of life, and suicidal ideation. So all things that we could be very concerned about. So again, trauma doesn't necessarily have to happen directly to you. We can receive trauma through various means and media and social media, and all of us have been exposed to that throughout the past year. Trauma specifically, it undermines our efforts to promote health, to promote safety and well-being for our communities. We know that trauma can manifest both at the individual and the community level. Unfortunately, historically, we've only looked at trauma through an individual lens. And what I mean by that is we've historically just focused on the individual in that moment and the events that they've been exposed to. But we know that there are residual impacts throughout our communities. The trauma that happens to one person oftentimes is going to be shared amongst the communities. And so when we're talking about community efforts, there are specific things that we need to do to counteract all of these variables. I won't sit here and tell you today that trauma and racism and discrimination are easily solvable. These are very complex issues. They have a lot of various root causes. There are economic and social issues that have to be addressed. There are institutional issues that have to be addressed. And so I'm an action-oriented person. I sit back and say, well, what can we do? And what we need to do is to develop communities, to develop our youth. And what does that look like? Oftentimes, it's going to be improving economic opportunities. We know there are correlations between poverty and poor health outcomes. So investing in communities, ensuring that people have access to quality education, to job training, and improved experiences throughout their communities is just a high-level idea of things that we need to be working on from a community standpoint to address how all of these complex issues are coming together and traumatizing the people that we live with. These are concentric circles here, and I like these because it helps us to really define our approach in the context of what we're talking about here. We all have different social support systems. We all have various resources that we can tap into. For some people, those resources are greater in number than others, and the same is true that some people don't have access to the same amount of resources. Social capital is something that consists of our relationships and availability to certain resources. On the left side here, it's noted specific support systems. It's not a comprehensive list. Does anyone want to jump in and give some examples of other support systems that aren't listed here?
Well, I'll chime in. I'm lucky enough to be at a place where there's a lot of support at work.
That's perfect, Patty. You teed me up well there. Work is a great place to feel like we have a support system. And the reason I say that is oftentimes many of us spend more time at work than we do at home with our families. You know, if we're working 8-hour days, that's 40 hours a week. We don't have time in the evenings to spend with families. So really it's that weekend that we're trying to invest. So I think work is a great one to name there. I would say that probably fits in with this purple circle here, my neighborhood or community. There are definitely other support systems that we could talk about that fall into that, whether it's a religious support system, a community center, or things of that such. But I think employment's a good one, and thanks for teeing me up there, Patty. So employer solutions, I think one of the silver linings of COVID is that employers have been talking about mental health, they've been talking about well-being, and we've been forced to consolidate resources and work more efficiently. And so we talked earlier that a lot of folks are either unsure of what telework looks like moving forward, or they're positive that their employers will continue to offer that. And so I am under the impression that a lot of organizations will continue to offer telework. But we know that telework does offer challenges for some people. For young people specifically, lack of motivation has been present when we're forced to work remotely. The statistics here show that about 70% of people are currently working from home. I see a lot of people at home right now. I'm trapped in the office. I'm kind of envious of you in some way. But we know that that's not always easy. Not having the technology or not being comfortable with technology can be something that people have to overcome. I was joking when I got on to the Zoom meeting this morning. I had to log in early because it's always the technology for me. I'm trying to figure out how to use it. What am I doing right? What am I doing wrong? Workspace issues can be a concern at home. I live in a somewhat small home. My wife works remotely, and she's been working either at the kitchen table or in our bedroom. So we don't have a defined workspace, which can be difficult from a cognitive standpoint. I've preached historically about, leaving your work at work. Well, if you're working at home, your work becomes a part of your home. And so sometimes it can be difficult to disconnect. Again, motivation can be difficult for some people. Personally, I think telework, it works well. We can be more efficient, but we are sometimes missing that personal interaction when we're only seeing each other over a computer screen. And for a lot of us, we've been staring at this computer screen for the past year, and that's not the easiest thing to do. A stat to point out there is mothers are more likely than fathers to say it's hard to balance work and family responsibilities. We have a women's inpatient unit here, and over the past year, we did see an increase in what our medical director had considered COVID-attributed stressors. So finding that work-life balance for mothers was increasingly difficult, and we did see that here anecdotally. So employers can offer various ways for us to get through all of these complex issues that we talked about today, but specifically tapping into mental and emotional health. I've got voluntary benefits listed here. Voluntary benefits have really been a win-win for human resources and businesses for a long time, but just recently they're starting to get more attention. And so we're talking about how do we offer better support to our employees to make sure they're doing well. This is a short list here. I'm sure we could add to that. Does anyone want to add to any other voluntary benefits that you have access to that maybe isn't listed here? I think EAP is one to touch on. Historically, only about 5% of people use their EAP, while 92, 96% of people have access to an EAP. Staggering numbers. I have not seen any research yet to indicate that EAPs were used at a greater rate during COVID. Again, I think access to mental health professionals who take EAP, at least in the state of Colorado, is somewhat limited. And so from an employer standpoint, we have to be sure that we're educating our staff members on what they have access to. I have to go onto an online resource portal to figure out exactly what I have. I have to consistently check what my insurance covers versus what it doesn't. But if we can take a step back as an employer and say, all right, we're going to have a series of messages that talk about, one, what you can do to be well, two, what resources we have in place for you. I think that's a good way to get this information to your staff. Going a little bit further into that, we found that working with our staff on the front lines here, that communication was key to us being effective as leaders, to being effective as an organization. And we found that our staff really wanted to know more. We can actually track response rates or people that open the emails that we send out on behalf of our CEO. And we found that the weekly COVID update email was the most well-received email that we would send out. People wanted to know, what do the COVID rates look like? What do the positive rates for employees look like? And then we'd include, a resource message or an uplifting message in that as well. And we know that people were tapping into that more than other emails, which I think says a lot. There's some other things that employers can do, stress management support, or bringing in consultative services to look specifically at how we can improve health promotion in the workplace is one thing. Again, there are stigma-related issues. Certain populations are less likely to tap into benefits. They may be scared to go see a healthcare provider or not know how to access that. So employers need to consider all of those things and do so in a meaningful way. There are incentives that you can offer to promote health in the workplace, wellness workshops that include prizes, wellness challenges have been popular in the past. One thing that I really like are screenings or services that are offered on site. So whether that is a quick visit with a massage therapist or coming in and checking someone's blood pressure, you know, little things like that that we can bring to the workplace. You're more likely to get people to engage in them if you bring it to them. We always talk about meeting people where they're at. I'd encourage employers to consider the same framework there. And what can you do? I always encourage people to lead by example. You need to be self-reflective in this. You need to know what is important to you, what are your personality traits, and how are you incorporating that in your day-to-day. It's important that you don't create or validate unrealistic expectations. That's both for yourself and for the people you work with. And then prioritization is key. As we touched on, a lot of people are lacking in motivation still. A lot of people are working from home and balancing so many things that it's important to be able to set aside work when we can and focus on what the essential priorities of that work are. So what I'm getting into really is leadership style, and everyone has somewhat of a different leadership style, but I would encourage you to know what yours is and to use that in working with your staff members and try to adapt in the moment. A leadership style may work well with one employee. You may need to switch it up a little bit for another employee. And then I'm always preaching self-care, self-care, self-care. I don't think we can say this enough. Again, a silver lining of COVID, we're talking about mental health now more than ever. Let's continue to do that. Let's not let this just be one event. Let's continue to talk about mental well-being and how whole person wellness, all of those things we talked about today, come together to promote a healthy person. We all do our best to juggle that Venn diagram on the side there. All of those things are part of who we are, and so we have to ensure that we're trying to prioritize those to the best of our ability. Some days are going to be easier than others. I know that if I'm working late, I'm not going to have as much time to go to the gym. I'm not going to have as much time with family, and so what I'm going to have to do is to ensure that I'm addressing that on a different day or in a different hour. We're all different, again, in how we prioritize these, but if we're not thinking about it, then oftentimes we'll just get stuck in the motions, and that's how issues come up slowly. There's some tips on the side there of things that you can be doing to promote whole person wellness. I'm sure you've heard a lot about these over the course of the past year, so I won't spend any more time there. Got some resources laid out for you. I just want you to know, we talked about specific populations, and oftentimes some of these groups here don't get enough credit. But there are specific healthcare resources for populations in our communities that people can tap into. So just wanted to share the word there. Obviously, we're a resource for you here at Health One. We're available 24/7. And then Psych Hub is a group that our organization partnered with to bring resources to people as it relates to mental health, as it relates to racism and mental health. If you have a chance, go on there. It's got so many good articles, research, videos, things that you can tap into. If you like what we talked about today, you can definitely further your education on that website. So we got a few minutes for questions. I know that was a lot in a short amount of time. Did we have any questions?
I have a question. Do you have any suggestions for maybe immediate calming or help, like from humor or breathing or anything where somebody could do something right away to bring themselves back from a spiral?
Yeah, so if we're talking about, mindfulness techniques, which it sounded like you talked about, one is just being comfortable with our emotions. So that name it to tame it that we talked about earlier, naming your emotions is extremely impactful. One thing I do to stay grounded, for any folks out there that might have some sort of anxiety that comes up, looking around the room and naming 5 things is something that you can do that's really helpful. Again, it just helps to engage a different part of the brain, helps you to stay grounded. YouTube, quite honestly, is a great resource that you could go to work on grounding techniques, mindfulness, breathing techniques are extremely important for folks, especially those with anxiety.
Thanks.
Yeah.
Other questions?
Well, again, I thank you for the opportunity to talk about this. I'm very passionate about the upstream work we're talking about here. It's all too common for crisis to be avoidable. And so talk about, what kind of things can we be doing in the moment? What kind of things can we be on the lookout for amongst ourselves and our peers? It's really going to make those lasting changes that we need in our communities at this point. Mitzi, I'll share the PowerPoint with you if you want to send that out to folks, and you can share my contact information as well. Feel free to reach out anytime.
Thank you, Addison. That was really amazing. Great information.
Yeah, thank you
So much. A lot of good helpful tips from an employer standpoint, which is important.
Agreed. Like I said, we spend more time with our employees than we do with our families sometimes. So